Good afternoon. Greetings from the Department of Orthopedics. We have entered the age of telemedical education. Nationwide homogeneity in evaluation of medical students used for PG entrance before the internship is the desire of the NMC now. So there is a change of MBBS curriculum, which is a small step in that direction. So no matter who says what, how difficult is the change will happen and we must adapt to it. The normal steps in any change are that there is a change, then you execute the change, then you monitor the effects of the change, identify weakness, and you change to optimize. And in the end, you have an optimal solution, the best solution for producing a good doctor for the people of India. So don't regret or oppose the change. Learn to welcome it and execute the change with all your heart. Because without the heart, you can never excel. Now, what is the change? There will be a part 1 exam twice a year, evaluating the MBBS final year with 100% multiple choice questions. This exam will carry a score on which admission to the postgraduate courses would be done, and so all MBBS students will aspire to score the highest possible, because these scores are competitive scores. They will rank students for PG entrance. Post internship, after the practical training, there will be a practical exam which will be quite structured by the university. Structured means great deal of objectivity in the assessment. And this will be just to declare eligible or not eligible to practice in India. What is our task? Our teaching must be geared to optimize student performance in this evaluation. What should be the plan? We should teach as per the content of the MBBS curriculum prescribed by the MCI. Not more, not less. It is futile to regret that my course and time is less and my course and time is more, because that is beyond your control. We in orthopedics have started making YouTube lectures so that the students can see them again and again, reiteratively, and maximize their learning from them. In these YouTubes, we use chalk and board. There is a real-time audio-visual communication by this. This lecture must comprehensively cover all concepts that can be used to generate an MCQ on that subject. Next, you must optimize delivery using communication techniques, including animation, which you are fortunate to have in the ERA Lucknow Medical College. The gist is Be logical, because only logical can be remembered and retrieved in an MCQ examination. You will have only 1.5 minutes to answer correctly. So speed and accuracy both are essential, and logical understanding is the route to speed. For example, if we are teaching anemia, we can say anemia is a decrease in the RBC or hemoglobin in it. This can be because there is less formation or more loss. The less formation can be because the factory is damaged, aplastic or hypoplastic, or the material is less, like iron or B12. Loss of RBC can be secondary to internal or external hemorrhage, or because there are ankylosome worms in the intestine which are sucking blood every day. The second reason can be hemolysis. The cause of hemolysis can be outside the cell or inside the cell. The outside cell, you can have antibodies like in Rh incompatibility. Inside the cell, the problem can be in the structure of the RBC, so that the RBCs are spherical and there is a deficiency of the enzyme G6PD. Then there can be fault in the hemoglobin, like fetal hemoglobin, which is called as thalassemia, or hemoglobin S, which is called as sickle cell anemia. So after they have understood this really well, you will have to decide them how to arrive at that particular node. For example, if we want to say that let us decide whether the manufacture is less or the loss is more, then the first step would be that we will rule out hemorrhage or blood loss, internal, external, or because of ankylosome. And secondly, if there is hemolysis, it will increase the indirect bilirubin and the reticulocyte count. If you want to ask an MCQ on this, you can say anemia with increased indirect bilirubin and reticulocyte count with spherical RBCs is spherocytosis, thalassemia, sickle cell anemia, or iron deficiency anemia. So you will have to give MCQs covering the entire content of your lecture. And then you will have to administer before the lecture. On YouTube, the student will come after seeing the lecture and attempting the MCQ. By seeing the performance of the students, you will identify mistakes. The difficulty index of the MCQs that the student have done wrong. And you will have to discuss the mistakes, strengthen the weakness of the students, but ignore the strength. Now we will demonstrate how we have done this in the Department of Orthopedics, and we will be very, very happy to help you do it yourself. Thank you.